Hello everyone, I'm Marissa Torres and I'm doing my disease report on tetanus. First, I'd like to begin with some history. So the disease wasn't discovered until 1884 when Carl and Ratten generated tetanus by injecting pus from a deadly human tetanus case into animals. Then in 1889, Kita Soto removed the organism from a human case and injected it into an animal, which then brought about the disease. In the early 1920s, a method for inactivating tetanus toxin with formaldehyde was developed by Ramon, which led to the development of the first tetanus toxoid, produced by Descambe in 1924. During World War II, this toxin was used as a prophylactic measure to prevent tetanus and was very successful. Here's a picture of Descambe's assistant Gaston Ramon. He had a big role in developing the vaccine against tetanus. So what is tetanus? Tetanus is an infection caused by a bacteria called Clostridium tetani. When the bacteria enters the body, it produces a toxin that causes painful muscle contractions. Tetanus is often called lockjaw because one of the most common signs of the infection is tightening of the jaw muscles, making it hard to open your mouth, swallow, and breathe. Clostridium tetani is a slender gram-positive anaerobic rod that forms terminal spores, giving that drumstick appearance. The organism is sensitive to heat and cannot survive in the presence of oxygen. However, the spores are very resistant to heat and the usual antiseptics. And here you can see the classifications of Clostridium tetani. So spores of Clostridium tetani are found in soil, dust, and the intestines of various animals, and animal feces, including that of a human. In agricultural areas, a significant number of human adults may harbor the organism. Its occurrence is worldwide, but that would be the most at-risk population where the climate is hot and damp and the soil is enriched in organic matter. Tetanus is different from other vaccine-preventable diseases because it's not contagious from person to person, but it is infectious as acquired through environmental exposure. The typical example is stepping on a rusty nail. The incubation period is usually between 3 and 21 days, although it may range from 1 day to several months, depending on the kind of wound. Once in your system, the Clostridium tetani bacteria and the spores release two toxins, tetanolysin and tetanospasmin. The function of tetanolysin is not known, but tetanospasmin is one of the most potent toxins known. It is a neurotoxin and causes the clinical manifestations of tetanus. The estimated minimum human lethal dose is 2.5 nanograms per kilogram of body weight, or 175 nanograms for a 154-pound human. Mechanism of action. So once the toxins are produced and disseminated through the blood and lymphatics, they act at several sites within the central nervous system. The typical clinical manifestations of tetanus occur when the tetanus toxin interferes with the release of neurotransmitters, blocking inhibitor pulses. This causes unopposed muscle contractions and spasm. So just so you can get a better feel of what happens internally, here's a close-up of an electrical message being sent down the axle of a motor neuron and arriving at the terminal buds. Chemical neurotransmitters are released, which bind them to the muscle fibers, causing them to contract. Shortly after, the neurotransmitters are released from the muscle fibers, allowing the muscles to relax. The repetition of this process tells the muscle fibers to contract and relax as required. So let's say, for example, you step on a rusty nail, and that has now introduced tetanus spores into the wound, and these spores then release tetanospasm toxin, which then enters the bloodstream and makes its way to the motor neurons. The tetanospasm toxin enters a motor neuron through the terminal buds, and the toxin then travels up the axle towards the neuron cell body, which is found in the spinal cord. It usually takes anywhere from 2 to 14 days for the toxin to reach the motor neuron cell body in the spinal cord. Here's a closer look-up of a synapse between a motor neuron and an inhibitory interneuron in the spinal cord. The motor neurons are controlled by interneurons. The interneurons prevent the motor neurons from constantly firing. Tetanospasmin toxin moves up out of the motor neuron across the synapse into the interneuron. The toxin prevents the release of inhibitory neurotransmitters from the interneuron. Therefore, the interneuron can no longer control the motor neuron. This allows the motor neuron to fire unopposed, causing the muscles to contract repeatedly until spasm occurs. Here you can see all of the motor neurons firing while the interneurons aren't. There are different kinds of tetanus. Generalized tetanus is the most common form, accounting for more than 80% of cases. The common initial sign is lockjaw. This may be followed by painful spasms of the neck, trunk, and extremities. In severe cases, seizure-like activity or convulsions occur. Localized tetanus is an unusual form of the disease, consisting of muscle spasm in a confined area close to the site of the injury. This is usually mild, but progression to generalized tetanus can occur. Cephalic tetanus is the rarest form and is associated with lesions of the head or face. Unlike generalized and localized tetanus, cephalic tetanus results in flaccid cranial nerve palsies rather than spasm. Nerve palsies can limit eye movements and cause doubled vision. However, like localized tetanus, cephalic tetanus can progress to the generalized form. Neonatal tetanus results from umbilical cord contamination during unsanitary delivery and a lack of maternal immunization. At the end of the first week of life, infected infants become irritable, feed poorly, and develop rigidity with spasms. Neonatal tetanus is a major cause of infant mortality in underdeveloped countries, but is rare in the United States. In generalized tetanus, the first sign is lockjaw, followed by stiffness of the neck, difficulty in swallowing, and rigidity of abdominal muscles. Other symptoms are elevated temperature and blood pressure, sweating, episodic rapid heart rate. Spasms may occur frequently and last for several minutes. Severe complications can also result from tetanus, like laryngospasm, fractures, nosocomial infection, pulmonary embolism, pneumonia, and death, which occurs due to respiratory failure and cardiac duress. 1 to 2 in 10 cases are fatal. To treat tetanus, hospitals administer human tetanus immune globulin, medicine to control the spasms, antibiotics, and wound care, and if necessary, a machine to help you breathe. There are 4 kinds of vaccines used today to protect against tetanus, which also protect against other diseases. DT protects against diphtheria and tetanus. DTaP protects against diphtheria, tetanus, and pertussis, which is whooping cough. TD protects against tetanus and a reduced dose of diphtheria. TDAP protects against tetanus and a reduced dose of diphtheria and pertussis. Babies and children younger than 7 years old receive full-strength DTaP or DT, while older children and adults receive TDAP and TD. The CDC recommends tetanus vaccinations for everyone. Another form of prevention is immediate and good wound care, so address any break in the skin, even if minor, and wash your hands often or use alcohol-based sanitizer. Since 1947, the number of tetanus cases reported each year just continued to decline, as you can see in this graph. The decline was in part because of the continued use of tetanus antitoxin for wound management and the introduction of the tetanus vaccines in the 1930s and 1940s. The vaccine led to routine vaccinations of all children and the addition of tetanus boosters for adults. Today, tetanus is uncommon in the United States, with an average of 30 reported cases each year. Nearly all cases of tetanus are among people who have never received a vaccination or adults who don't stay up to date on their 10-year booster shots. So that's the end of my slideshow, and these are my sources. Thank you all for watching.